presentation. Mixed reality for orthopedic surgery. We're going to use this device called HoloLens that we can manipulate things as this text, and we are going to show you guys how can we use this kind of technology for our cases in orthopedic surgery. Let's join us. Bye bye. Okay, this is an example of a mixed reality model that I can join. This is a scapula that you can see here. Okay, we can turn it to see everything around this scapula. I can check the retroversion. I can move it around. I can move it. Okay, I can see directly through it. In this case, we are using a model. It's a evolutive model. This is the implant that we have here, the base plate and the central pin of the glenoid. Okay, let's move here. And now we have here our planning. We can see directly through. Probably the field of view of the recording is not exactly what I'm seeing. I'm looking it on a 3D space. You can see my computer over there. Oops. Okay. I can look directly inside the model as well. I can go inside it. Let's close here. Let's look inside the model. Okay. Let's zoom a little bit to make sure and to check here in the part, the posterior anterior part of the scapula. So this is the planning that we can have in our OR room. Let's rotate a little bit this model, and here we have everything that we can check for our planning and place it wherever we want during our surgery. I can place it in space like that, and I can have the surgery over my field of view right here. Close. Close. Example, a patient with a clavicle fracture. It's a left clavicle fracture. Let's take a look here. Let's move on this. So this is the patient. This is the CT scan from the right side and the left side. Here we can see the fracture. Okay, let's move it around a little bit. We've done our planning. This is the planning that we have done. We planned the surgery using a locket plate. Here we can see all the screws that we have planned for this surgery. Okay, now we are looking backwards behind the patient. Now let's look in front of the patient, remembering that this is the left clavicle. I can zoom a little bit to check if everything is correct. Let's move around. And here we have the medial fragment planning for each of the screws that I can see exactly the location of each of the screws. Let's zoom out a little bit. Let's take it there. And here we have the lateral fragment planning. Here we can see it. This is the screws, the location of every screw that is based on this planning you were seeing just around here. So this is our example of how can we use mixed reality to a planning of a very simple surgery like a clavicle fracture. Here we have all the models that we have planned, and we can position them wherever we want in our studio. Here we are in our computer. As you can see here, we are live. And this is where we open the files that we want. Here we are. Now we're going to see another example. This is a planning that we have done using MRI. It's kind of challenge. So this is a planning that we done with a scapula. We have downloaded the scapula from an MRI and we did the planning using a Exactech implant. And here we can see our planning virtually in front of our hands. We can check that this patient has some inclination, but the correction, the position of the implant is in the correct position, as we can see right here. This is another example of how can we use 3D planning and augmented reality for helping us during our surgery.